Well, thank you for joining us. Appreciate you coming today. I'm here to talk about certificates of health informatics that our School of Biomedical Informatics at the UTHealth Science Center at Houston is doing in conjunction with the College of Health Sciences here at UTEP, UT El Paso. My name is Susan Fenton. I'm the Associate Dean for Academic Affairs at the School of Biomedical Informatics in Houston. So, we are one of 6 schools at the UTHealth Science Center at Houston. You can see we also have a medical school, public health, dentistry, nursing. So, but then we also have this school that a lot of people don't have, which is biomedical informatics. There are currently 51 biomedical informatics programs in the United States. We are the only program in Texas. We're the only freestanding school in the entire United States, and we're one of the largest in the nation, and we'll talk numbers later. Most of these other programs that you see on the map here are actually departments or divisions, typically located in a medical school. So what is biomedical informatics? And you can read this for yourself. What I like to ask people is to think about any encounter they've ever had with the healthcare system. So whether it's been visiting a clinic or a hospital or anything to do with healthcare, and then think about that encounter without the information. And the bottom line is that at that point, it doesn't exist. So it's really, really difficult for any healthcare to be delivered without some type of information exchange. And that's what our school is about. It's about any of those information exchanges, and our ultimate goal is to help improve the human health. So we really want to help improve our healthcare delivery system and everyone's health in the U.S. and the world. So when we talk about biomedical informatics, what do we mean? We actually, at the School of Biomedical Informatics, have faculty who have expertise in everything from the molecular genomic through imaging informatics, clinical informatics. This is where you would be thinking typically your electronic health record, actual patient encounters, those types of things, up to and including public health informatics. So when we're looking at different populations, whether it be at the city, county, state, national, or world level. So looking at the population and how we can bring information to bear on that. So for us, all of that includes biomedical informatics. We are a very large school of informatics. We currently have 26 regular faculty with a wide variety of expertise. We've added 7 new faculty within the last 18 months or so. And just to give you an idea of some of the expertise, Dr. Zhao is actually a bioinformatician, so he works with the genomic data. Dr. Champagne was most recently Vice President of Houston Health Connect, so our health information exchange. So her expertise is on exchanging the data between different settings and care providers. Dr. Murphy was recently the Chief Medical Informatics Officer for the Memorial Hermann system in Houston. It consists of 13 hospitals and thousands of physicians. So he was in charge of all of their informatics, and now he's at the school. Dr. Angela Ross was the Chief Medical Informatics Officer for the Defense Health Agency in San Antonio and worked at BAMC at Brooke Army Medical Center. So she comes with a significant background in informatics. Dr. Deborah Simmons comes out of nursing and most recently was the Senior Executive Vice President for Quality Improvement at CHI St. Luke's in the Texas Medical Center. Dr. Wu is a biostatistician, and Dr. Roberts comes to us from the National Library of Medicine, and he is actually a natural language processing expert. So he takes the free text and figures out how to make it computable. So a lot of different expertise in our school. We also have 53 adjunct faculty, and again, all different areas of expertise. So why is this field important? One of the main reasons is because of the enormous growth in the amount of healthcare data that we have. And so you can see these statistics here. So then these statistics are from 2012. So 150 million terabytes, and it's 30 times the amount of data from the beginning of history up through 2003. So it's just a huge, enormous amount of data. But the data is really useless unless you can take it and turn it into information. And that's really what we're trying to do at the School of Informatics. The future of informatics, so this comes from McKinsey Global, and you can see things that are booming are the Internet of Things, cloud technology, and mobile internet. And this is the potential economic impact in terms of dollars. And then we see that McKinsey estimates that 2 million additional data workers are going to be needed by 2018, which is not as far away as it seems. U.S. News and World Report. So can you get a job in this field? Absolutely. U.S. News and World Report in 2015 recommended pursuing a career in health informatics as one of their top 9 careers. From 2009 to 2012, we saw a tripling of health information technology jobs at a time when all jobs increased by 57% and healthcare jobs increased by 52%. So lots and lots of opportunity in this field. In Texas, I did a study in 2011, looking at need in 2011 to 2013. We estimated in a very conservative estimate that additional 10,000 workers were going to be needed in Texas. And during this same time, all of the programs in Texas, associate, certificate, baccalaureate, graduate, were going to graduate less than 2,000 health information related professionals. So we have a huge gap. We know there's a lot of demand. At the School of Biomedical Informatics, one of the things that we really pride ourselves on is partnering with lots of different people, and obviously with UT El Paso, but we also have partnerships with all of these different care delivery settings. And then we also partner with, for example, the Houston Department of Health and Human Services, which is our public health agency in Houston, the Harris County Public Health Service, the Department of State Health Services for Texas. So we do also partner a lot in the public health arena. We believe our education should be interdisciplinary. A lot of our classes will involve team assignments, and often we'll even partner with people in terms of delivering some of our classes. So for example, we have an HIT policy class that's taught in partnership with our School of Public Health at UT Houston. So we really think we are a true interdisciplinary field where people come from a lot of different directions into informatics, and it's important for everyone. We also have international collaborations in the countries that you see here, so Mexico, Colombia, Brazil, and China, India, and Turkey. So a lot of international collaborations. I currently am the principal investigator on a training grant where we are developing curriculum to deliver continuing education training on healthcare data analytics, population health management, care coordination, and value-based purchasing. Beginning in the fall of 2016, we will train a minimum of 1,000 people on this grant. So our programs at UTHealth School of Biomedical Informatics, we have certificates. They consist of 15 semester credit hours. We have 3 different certificates: applied, traditional, and public health. Those semester credit hours do roll up into our master's degree, which is 39 semester credit hours. And then we have a doctoral degree also at 93 credit hours. Our certificate and master's degrees can be done entirely online, so you don't ever have to come to Houston. You don't ever have to set foot on our campus. It's perfectly fine. So both of these can be done entirely online. The doctoral degree does require a campus presence. In the fall of 2015, we had 247 students enrolled. In the spring, we had 297, so we are growing by leaps and bounds. We're very pleased with the diversity of our student population. You can see here we have people from a wide variety of backgrounds who get interested in this field and come to our school. There's no one picture of someone with informatics training. So for the UTEP programs that we're launching here, this is just the General Health Informatics Certificate. Our students will take Introduction to Health Informatics, Introduction to Electronic Health Records, and our Health Information Visualization and Visual Analytics, and then 2 additional courses from their area of study here at UT El Paso. Again, entirely online in an asynchronous format. For the Public Health Informatics Certificate, we have, again, Introduction to Health Informatics. This is our leveling course. So if you come from an informatics, from an information systems background, the information systems part of our intro course will be easier. If you come from a healthcare background, that part of this course will be easier. So this is a required course for all of our students, Intro to Health Informatics. Then we have a Principles and Foundations of Public Health Informatics. We accept epidemiology and biostats from public health here at UTEP. And then there's a 5th course recommended either from the informatics choices or we will have a list of public health courses that could apply to this also. So that's it. We have our website is up, and questions can be sent to SBMI academics@uth.tmc.edu if you think of something after this. But can I answer any questions for you today?
If I plan to graduate during the summer, I still can apply later?
Yes.
Okay.
Yes, absolutely. Do you already have a bachelor's degree?
Yes.
Okay. So all we require is a bachelor's degree. And this is open to both current students and alumni of UT El Paso. And our deadline for applications for the fall is July 1st.
Okay. Thank you very much.
You're welcome. You're welcome.